Minimum initial service package for sexual and reproductive health in emergencies. Nepal is a small landlocked country, also regarded as one of the beautiful countries in the world. But the country is at high risk in terms of vulnerability to natural calamities. Out of 198 countries in the world, Nepal is listed as 4th most vulnerable to hazards of climate change, 11th most vulnerable to earthquakes, 38th most vulnerable to floods. One happy family, but nature has its own say. Disasters, earthquakes, floods, landslides, fire. Panic prevails. Children get separated from their families. "75% of those affected are women, children, and adolescents. The entire village is at risk. 4% of women are pregnant at any given time. 15% of them will face life-threatening complications. The pregnant woman is stranded. No emergency care. No medical attention. She cannot deliver her baby safely. 50% of maternal deaths occur after delivery in the first 24 hours. She delivers her baby in distress. The delivery is unhygienic, unsafe, and risky. Risk of infection and injuries for mother and child. Even if they reach a camp, women face hardship. No food, no drinking water, no emergency medical care, no security, no separate toilets for men and women. It is difficult to prevent diseases in disaster scenarios. For others affected, no contraceptives, risk of unwanted pregnancy, unsafe abortion, mental stress. Meanwhile, children who are separated from their families are also at risk. No parental care. They lack sanitary supplies. They face psychological trauma. They live in unhygienic conditions. They sleep in open areas. They use unlit toilets. They are unprotected. They face sexual exploitation, trafficking, and rape. They are prone to unwanted pregnancy, unsafe abortion, risk of HIV and STIs.
Now, imagine a different scenario. Minimum Initial Service Package, MISP. A prepared Nepal. Prevent, prepare, preposition. How? By advocacy, coordination, capacity building, risk assessment, prepositioning of drugs, reproductive health kits and equipment, timely dispatch. Now, when disaster strikes and the woman is stranded, she has a safe delivery kit. Sterilized blade, clamps, plastic sheet, soap, gloves. A mother saved, a baby saved. Now, even at a shelter, women have access to trained staff, assisted delivery, emergency obstetric and neonatal care, and others have access to condom contraceptive pills. A multi-purpose shelter with improved living conditions. Separate areas for men and women. Separate toilets. She is now free from sexual exploitation, trafficking, and rape. She now has a dignity kit, clothes, sanitary supplies, torchlight. Now she can fetch water and food without stigma. MISP enhances coordination for basic sexual and reproductive health services, reduces maternal and neonatal morbidity and mortality, prevents and manages consequences of sexual violence, reduces HIV STIs transmission, helps plan comprehensive reproductive health services. Now we are better prepared.